of you guys have been sitting for a little while, so as the old saying goes, the mind can only absorb what the seat can endure, so get your seat up off the seat. Get some blood in there. Arms up in the air. Let's clear some blood sugar. Turn to your neighbor and say, "You were born a champion." Woo-hoo! All right. We are ready. Good, good, good. Well, welcome everyone. Thank you for being here. We have a great classroom tonight. What are you here to learn about? Diabetes, blood sugar control. You came to the right place. Every month we do a different class, a master class. That's the schedule. If you don't have one, please make sure you get a card, and it tells you what we're doing every month for the entire year. We have a schedule, and believe it or not, we've been doing this for 26 years, and have not missed a month. So consistency is the key, and the more you come back, the more you learn, the more you grow. When you stop learning, you stop growing, and when you stop growing, you start dying. All right, so I'm assuming everybody here loves to experience constant and never-ending improvement. Raise your hand if that's true for you. Say aye. Aye. Fantastic. All right, and one more. Are we waiting for them? Okay, good. And so, with talking about diabetes, make sure everybody, you guys have you have a pencil and paper, right? Because we're gonna get into taking notes here tonight a little bit. So the thing with diabetes, as you all probably very well know, is it's not the leading cause of death. What is the leading cause of death? Heart disease, cancer, and now we have like dementia and Alzheimer's pushing up into the top three. But then you have diabetes, and diabetes is so common that we just think it's normal. But really, so many of the cases that are and the people that are diagnosed with heart disease and cancer, that's just the effect. And the primary cause, which leads to these things, in many cases, is diabetes, is running high blood sugar. So it's the one disease that can cause so many others. That's what makes this so important. It causes heart disease, cancer, dementia, Alzheimer's, kidney failure, blindness. It takes literally close to a decade off of your life expectancy. Problem is, it sneaks up on you, and by the time you're diabetic, it's too late. And so most of the people we know today are either pre-diabetic or diabetic, and it's just so common we think it's normal. So it's very serious. And then the other thing that's troubling is the way that we approach this. So if the Bible says, "For lack of knowledge, people perish," right? And with that being said, it's how many people do you know that actually have access to the resources and the information to correct type 2 diabetes without medication? So far and few between. Like, people don't even know that it's an option. It's like mind-boggling when I meet somebody and they don't even know that type 2 diabetes is 100% reversible. They're like, "What? Really?" Come on, it's all over the internet. It's all over. Like 2 years ago, no, you couldn't find it. But we've been teaching this for a couple of decades now. So the reality is that when an individual is first placed on medications like metformin, insulin, Januvia, Rybelsus now, these are short-term solutions. The idea isn't to stay on it for the rest of your life, because number one, you're not correcting the cause of the problem, and number two, what? What do you see up there? You see side effects, right? Even in the Journal of the American Medical Association, they said older patients with type 2 diabetes on medications may do what? More harm than good. So that's my biggest concern. When people think that they're off the hook just because they're on, they have metformin or they're taking Januvia. And I'm not saying there's not a time and a place and a necessity to take medication. If your blood sugar's through the roof, you got to get it under control. And then as time goes on, when you learn these things and you start applying what I'm going to teach you tonight, there should be less reliance on this. Does that sound fair enough? And that's what I want to try to help you with. National Library of Medicine published a study, and you can see here the link now with blood sugar and dementia. And so this study was alarming as it showed the consistency with blood sugar and blood glucose levels rising and a clear path to dementia. And they connected it with A1C. Even without diabetes, they said elevated blood glucose appears to have adverse neurocognitive consequences. So is A1C important for your blood sugar? Yeah. What does it show? It shows a trailing 3 months of what your blood glucose looks like. And if it's under 5.4, you're good. You're in the normal range. When you start going beyond that, then you start trailing into the area of diabetes, which we know is a no-no. But what this study shows is that what comes soon after with that, if it continues to run in that in that range there, that 5.7 to 6.4, 6.5 or higher, if it stays there, then you're on your way to dementia and Alzheimer's. A lot of people don't know that. So this is super important because when you look at what's happening with dementia and Alzheimer's these days, what do you see happening? Is it happening less or is it happening more? Yeah, we're seeing more and more cases being diagnosed as time goes on, and the incidence and prevalence of diabetes, if we look at this over the last couple of decades, is just getting more and more common. So those two are going hand in hand, which makes it one of the most important considerations that you should be getting tonight and learning about. So let's talk about insulin resistance, because this is where it starts. And does everybody know what insulin resistance is? Insulin resistance is when your body is not able to clear the glucose from your bloodstream. In other words, it can't get from your body is having trouble getting it from the bloodstream into the cells, into the muscles, into the tissues, into the brain. And so here's what happens. If you look at this picture here up here on the left, you'll see a cell. That's the surface of the cell. And you see the blue channels there, those are insulin receptors. And then you see the little red dots, that's glucose, that's the sugar rising in your blood. And then the blue dots there is what? Insulin, right? So here's what happens. You have a moderate glucose rise, and this is how it happens in a healthy situation. This is what we want happening with your body being able to clear the glucose from your bloodstream. You have low sugar fruits, vegetables, you got your proteins, you got your fats. You have a moderate rise in glucose, right? So moderate rise in glucose, you have a moderate rise in insulin. The beta cells in your pancreas make the insulin so that it can go into the insulin receptors. And does everybody see those blue dots there? Yeah, it drops into the insulin receptor, kind of like a key that goes into a lock, and then it opens up the insulin receptor to let the glucose in. See how that works? It's amazing how we were created and how intelligent this is and how your body knows how to do this. And if you give yourself the right foods and the right quantities and you keep yourself well, this should be working the way it's supposed to work. Now, most of the time it does, but sometimes we start eating other things and we eat too much of it and it becomes our lifestyle and we develop something called insulin resistance. What is insulin resistance? It's when your body really kind of starts going on strike. It's not used to all of the sugar that's in your bloodstream. It's not used to all the glucose, and it gets to the point where your body has to make so much insulin to clear the glucose that it gets tired. It's like tired of being whipped and beaten into this for breakfast and lunch and dinner, and so it becomes resistant. And then in that situation, we're eating high glycemic foods, which spike and provoke an insulin response. And that's what causes your body to just kind of shut those insulin receptors down. So your body can make the insulin, and it may have the appropriate response, but those insulin receptors are shutting down. You see over here where those blue arrows are, you see that? Those are not seeing the insulin drop in there and open up that channel. And so if the glucose can't get into the cell, where does it stay? In your bloodstream, right? And that's where your A1C goes up. That's where your fasting blood sugar stays and high. And that's when you go to the doctor, and then they start putting you on metformin and insulin. And insulin will work to open that up and get the sugar back into the cell. But is it correcting the cause of the problem? No. So if you can correct the cause of this problem, is it possible to reverse type 2 diabetes? Yeah, it is. So that's what we have to work on. Another thing I want to talk about briefly is that fructose and alcohol is metabolized by the liver, which means without utilizing that mechanism that I just showed you, like having an insulin response to, have insulin receptors force the sugar into the cells, with alcohol and sugar, it can bypass that. It goes straight to the liver. The liver is the only place where it metabolizes fructose, which is what? Sugar, right? Fruit, alcohol, high fructose corn syrup, all these things. And that's what causes fatty liver disease. That's why we're seeing more of that now with adults and kids where they don't really seem overweight, but they have fatty liver disease. It's hiding in so many different foods like your ketchup, tomato sauce, and a lot of different foods. High fructose corn syrup is become ubiquitous. And this is how it affects your liver. And this is what drives obesity, and it also causes insulin resistance just by going straight to the liver. Is that making sense? Yeah. So, am I saying fruit is bad for you? I'm not saying that, but I am saying too much of a good thing is not a good thing. You've heard that before, right? Yes. So there's a difference between having a huge bowl of fruit and having a small bowl of fruit. There's a difference between having high sugar fruits and lots of them in an unlimited portion and choosing low sugar fruits. Now I'm talking to two different people here right now. I have a group of people, but some of you are diabetic and you want to reverse that condition. You really want the keys to how do I reduce and get off my medication and correct this problem. And then some of you are in here, you don't have diabetes, but you really just want to learn how to correct your metabolism, maybe lose some weight, right? So I know not everybody is the same here, but what I would say is if you're like me and you just want to maintain and you want to stay healthy, either way, I like to gravitate toward the low sugar fruits. Like you see the berries up there, the blackberries, raspberries, grapefruits, strawberries. I always keep my refrigerator stocked with that. But, in the morning, I just grab a handful. Really, no bigger than the palm of your hand. And then with that, I'll have some almond butter, sometimes some peanut butter if I want to cheat one day. But some good fats with that. But you guys get the point. Your body can only handle what? Small amounts of fructose. All right? So these are things that will affect your blood sugar. And, you do have a predisposition genetically to this. If anybody here has ever had a DNA test, you can see some of your genetics will predispose you to carbohydrate intolerance. And some of you may be different. You can handle it better. But it doesn't matter what your genes are for better or worse. If you put on 10 pounds or 20 pounds, you start becoming insulin resistant. And you start not being able to process those carbohydrates as well. And so it's a vicious cycle. So the more that you're provoking that insulin response, the harder it's going to be to get your weight down, the harder it's going to be to get your blood sugar down. It all works hand in hand. Is that making sense? So, as a matter of practicality, let me just ask you, how does that look for a breakfast if you're trying to get your blood? That's a no-no, right? It's high glycemic. What does high glycemic mean? High glycemic foods provoke an insulin response, right? High insulin, which is a no-no. That's what we don't want. What about a bowl of cornflakes? High glycemic index. It's going to spike your blood sugar, right? What do you see here? Bacon, eggs, and somebody said yum yum. Can't argue with that. But again, if you're diabetic or you're trying to lose weight and regain insulin sensitivity, what do you see in there? What kind of carbs are there that may hinder that in the immediate term? The potatoes, right? Now listen, once you get things under control, can you have some potatoes? Yeah. But again, who are you in this spectrum that we're talking about? If you're having an Egg McMuffin or a bagel with, tuna, again, what are you starting your day with? A high glycemic index. And when insulin goes up, guess what? Your body starts storing fat. Not burning it, starts storing it. What about for lunch? Beware the bread. Does wheat bread have a lower glycemic index than white bread? Yes. So at some point when you do start eating bread, that would be a better choice. But for now, that may be a no-no. If you're trying to stabilize your blood sugar, bring your A1C down, your fasting glucose, then I would steer clear of that. What do you got here? God bless Chick-fil-A. But it's fried, but if you have the bread there, you're creating a problem with your blood sugar. Same thing with the flour tortillas. Now, don't be fooled. Like with some of these that have the keto bread now, and it shows 0 carbs. Some of those products are almost like artificial sweeteners, or even the natural sweeteners that have 0 calories. When it goes into your body and it's sweet, your body still has the same response as if it was real sugar. You can't trick your body. So you have to keep that in mind with these new fashion foods that are heavily marketed. They just press our buttons and we think like, oh wow, that's good. That I can have my cake and eat it too. Maybe not. What do you see here for dinner? There's pasta, high glycemic index. You have a baked potato. Again, so it's these foods, they do have nutritional value, but in the context of reversing type 2 diabetes, getting our blood sugar under control, and trying to lose 10 or 20 pounds to regain insulin sensitivity, these are the things that we want to look for better alternatives. Is that making sense? Okay. So these are just things that I just wanted to point out. Make sure you understand what you're doing when you have those things. And you may not be doing it on purpose. It may be just a matter of learning what alternatives there are. We'll go through that also. But again, the key to losing weight and reversing type 2 diabetes it's really more, it's not counting calories. How many of you guys have done a diet before? Right? Jenny Craig, Weight Watchers, I remember watching my mom do that for decades, and she would lose a couple pounds here, a couple pounds there, and eventually it all goes back. Because it's not about counting calories. Losing weight, correcting your metabolism, correcting diabetes, type 2 diabetes, it's about correcting the hormones and correcting the metabolism. This is a battle of the hormones. Did you get that? What is it a battle of? Hormones, yeah. Insulin is a hormone. Insulin is a hormone. And so, when you go and you buy your steak or your beef or your chicken or your fish, now when you go into any of the grocery stores, what do you see on the shelf? You see stuff that's been pumped up with corn, grain, so that they can make those animal products as what? As big as possible. And the reason why they feed it grain is because what does it do to the insulin in that animal? It raises it. So we're no different than farm animals from that aspect. When insulin goes up, it's driving fat accumulation in the human body, just the same. So pretty simple. How do you correct that problem? Keep the insulin down. Get the hormones under control. If you keep that hormone insulin down, instead of storing fat, your body releases fat. Instead of storing fat, if you keep insulin down, your body what? Releases fat. That sounds so easy, doesn't it, Dudley? And just let it go. I don't even have to try to lose weight. It's just going to unload itself because of the hormonal response, because of the fact that you just corrected your body's chemistry and you gave it what it needed and you got the heck out of its way. It does what it was designed and created to do. God doesn't make junk. So part of the problem is what we were taught to do. When we were kids, when we were in elementary school, they showed us this food pyramid, which wrecked us. It caused us to start gaining weight, childhood obesity, diabetes, and all the other problems. You see, how can you possibly stay healthy when 60% of your diet is high glycemic carbohydrates? It's only a matter of time until that individual starts having health problems. So we were set up for failure from the get-go. That's really what the food pyramid should look like. What do you see the base of the pyramid as? Your proteins, your vegetables, low sugar fruits. You got your nuts and seeds, good healthy fats. I think for all of us here who are trying to get healthy, just to keep it simple, that's a great place to start. How many of you have heard of the paleo diet? That's another good resource. But again, I'm not saying that you can never not have carbohydrates. That's not what I'm saying. What I'm saying is that in order to enjoy those things later, you have to correct your metabolism now. Once you correct the metabolism and it can handle that and you regain insulin sensitivity, guess what? You can start having some of these things, oatmeal, sweet potatoes, and some of the lower glycemic carbohydrates. And that's the normal course of events as your healing progresses. All right, so let's look at what an ideal type of breakfast, lunch, and dinner should look like. So in the morning, that's my kitchen counter. I've got my medley of berries. I have my complete clean shake, which is 2 scoops of, it's not, for lack of a better term, protein powder. I like it because it has 26 grams of protein, and I have it right after I exercise. But it's also got a multivitamin spectrum in it, it's antioxidant, and it's got all the nutrients in it. So that's my protein source. And then I have, you see the almond butter back there, okay? And so if you're looking to start your day and program your body to burn fat all day long, you don't want a high glycemic index, right? You want to start off in fat burning, so what do you have to do? You have to have a low glycemic breakfast. You see anything in that picture that would provoke an insulin response? No? So how about scrambled eggs and all of the veggies in there? Same thing. Safe to keep your blood sugar stable. What would you cook with that with? What kind of oil? Olive oil, avocado oil, right? Almond oil. Cook with ghee or grass-fed butter. Talk about fat burning. All these good healthy fats, yeah. And then over there you have your scrambled eggs. You got your avocado, which is good healthy fat. You got your proteins. You got chicken sausage. But again, what do you not see in any of these pictures? Crush. So anything that would spike an insulin response, right? So for now, this is a safe bet for everybody in here who, again, looking to reverse type 2 diabetes, looking to lose weight, correct your metabolism. Once that is accomplished, what might you be able to add to some of these? Steel cut oats, right? Maybe you have your potatoes, right? Okay, you could have some of those, just a little bit. But it's very, very important also that you don't have those by themselves. You have to have those carbs with a protein and a good fat or a vegetable. You have to have those together to slow down the digestive process and make sure that you prevent that insulin spike, right? Now, these are important points here. What do you see for lunch? What are some good alternatives for lunch? A nice healthy what? Salad. With the salad, you can pick your protein. And what kind of dressing helps your body to prevent an insulin surge? Vinegar. Very good. Very good. Olive oil and vinegar would be the best. And have that with your salad, or you have it before your meal. Those are, I mean, that's one little thing that will make a big difference with helping to prevent an insulin spike.
You mean what, vinegar before the meal?
vinegar, olive oil on like a salad right before your meal. You can drink apple cider vinegar before your meal. You can do that also. I see. I see Denise starting to heave over there. Some of you guys don't like the thought of that. But studies have shown that it does help stabilize your blood sugar. It does.
Like a shot?
You can have a shot. You can put a couple of tablespoons in a small glass of water. Drink it slow. Shoot it. Doesn't matter. Yeah, whatever tickles your fancy. But nonetheless, studies do support that it helps with your blood sugar. Yeah. So for dinner, what do you see here for dinner? You have lamb or pork chops or a piece of steak, preferably grass-fed, right? And then you have your vegetables. Now, also, what's important, because again, you don't want to be hungry. Like if you're going to eat dinner at 6 o'clock and you go to bed at 9 or 10, after a few hours, your stomach may start rumbling, right? If you don't get a good enough amount. Now, you know that if you start eating a lot of carbohydrates, your stomach's going to expand. It expands you can do that with bread, you can do that with pasta. But what do you do if you're eating like this? You have to make up with the fats, all right? So in a case like this, lots of extra virgin olive oil, unlimited vegetables will not affect your blood sugar. And that's what I like to do. I'll have my protein source. If I have a little bit of white rice, it will be jasmine or basmati, okay? And again, I'm in the maintenance stage, so like I said, when you guys get to that point, you can have a little bit of that. Brown rice has a lower glycemic index. You can have a sweet potato or a half a sweet potato, you can do that. But again, when you get to that point. But for now, this right here, just the proteins, vegetables, and fats, fastest way to stabilize your blood sugar. Are you with me so far? You see a nice, beautiful stir fry over there. You just don't see the rice in it. But when you do get to that point, add a little brown rice. But please, again, if you're trying to see results happen quickly, you don't want to do that in the beginning. You don't want to have a cheat day until you start seeing things change. All right, so is everything that I showed you making sense so far? Okay, good. So with the complete clean, I wanted to go through this with you. How many of you guys have used this? How many of you guys? A couple of you? Okay. So you can, I was talking to you about me doing this during breakfast after I have my exercise. You don't have to just do that. I've had many of my patients use this as a meal replacement. And you can actually do this because it's got all the vitamins in it. It's got a good healthy protein source. And what you can do is you can make a smoothie out of it. You can add some fruit in it. You can put your coconut milk or almond milk in it. You can also add some vegetables. You can make a veggie smoothie, fruit smoothie. There's a lot of different things that you can utilize with this. But the reason why I'm sharing this with you for purposes of our class tonight is because it has a very low glycemic index. It will help you keep your blood sugar stable. And it saves time, so you don't have to scramble trying to throw something together. If you're in a pinch for time, like I am when I'm trying to get out of the house in the morning, that makes this ideal for me. With the rising cost of eggs and other protein sources today, in many cases it's a money saver too. So I wanted to recommend this because when you look at the label on this, it is just chock full of all types of supplements, antioxidants. It's got a low-level detox in it. It's got green tea extract, which also helps with fat burning. So I thought it was a good idea to share this with you guys so that you knew why we put it in our supplement suite.
Is it a powder?
It's a powder, yeah. It comes in vanilla or chocolate, and despite like what most supplements taste like these days, this actually tastes really good. So we have a lot of patients that take it. We have a lot of patients that do well with it, and you're not even thinking that you're taking something healthy. It really tastes like a treat. But I would encourage you to try it. If you haven't tried it, I think you'll really enjoy it, and you'll see good results with it if you're trying to see improvements with your blood sugar, for all those reasons that I was talking about. Another supplement I want to speak to you about is NAD, or It's actually an NAD supplement. What is NAD? Most of you in the room probably don't know. It's really newer on the scene with all the research that's emerging right now. Nicotinamide, adenine, dinucleotide. Say that 3 times fast. No, you don't have to. Okay, but it's a coenzyme that actually is necessary for many different cellular functions. And the problem is that as we get older, it typically declines with age. Particularly between the ages of 30 and 70, you start to lose about 65% of this, which pretty much correlates with when there's depletion with this particular coenzyme, you start to see metabolic dysfunction in the form of obesity, diabetes, as time goes on, dementia, frailty, cancer. So they know that this occurs simultaneously with the depletion of this, and they found that replenishing this nutrient can actually help to reverse and improve many of these conditions. So if you could replenish that, and there was a supplement to do that, what would that look like? Well, and again, this has all been published in different studies and different platforms, but that's what this shows. A lot of these aging diseases, that's why I talked about this last month in our anti-aging class. But for tonight, because we know of the metabolic advantages this gives us, that's why I wanted to put this in here, because of the effects that it has for fat metabolism and insulin sensitivity in particular. So this is called resveratrol. I've been utilizing this myself for over a year now. And as far as the anti-aging benefits, I've seen cognitive improvement, improvement in recall, definitely enhancement with being able to manage my weight, my glucose tolerance. So there's more and more research coming out on it. I would recommend it if you are looking to add some sort of supplements to your routine, which will help you to control your blood sugar, anti-aging, if that's important to you. But everything that we put in that suite tonight, those 3 in the supplement suite, in particular is for regaining insulin sensitivity and your blood sugar. How many of you guys have heard of berberine, alpha lipoic acid? I ran videos the last couple of weeks. We always do. Many of you take it for your blood sugar. But with this particular resource, Ultraplex Sugar Balance, we finally were able to get one product with both of those together in it. So it makes it a lot easier, and for some reason it seems to be more effective. Because I have 2 patients in particular who had trouble with their A1C running over 10, 11, 12, if you can imagine that. Yeah. And then so with these 2 patients, and with the fasting blood sugar, neither of them were able to get things within normal limits. And they were both diabetic, both on diabetes medications. And this is recently. I've had a lot of people taking this for a long time. But the point I'm making is with this particular supplement, when they started taking this, things started correct. The A1C and the fasting glucose started correcting so fast, it made their endocrinologist head spin. They wanted to know what they were doing. And so they brought the supplements into him. They said, this is what we're doing. He was like, all right, we'll keep taking it. One of them ran out, didn't take it for a couple of days. What happened with his blood sugar? Right back, he came running back in, like I hadn't seen him in a couple of weeks. He's like, I just got myself 4 more bottles. This is for real. My doctor told me to stay on it. So if you have type 2 diabetes, if you're on medications, if you're serious about getting something that actually does work, this is where the rubber meets the road. This one in particular. Yes?
I have a question.
Yeah.
How would that affect, if any, the medication that you're currently taking?
It's a good question. If you're on medications right now, how would it affect it? These are nutraceuticals. They're natural. It's like eating food, so there's no interaction with your medication. So what happens is if you are monitoring your blood glucose and it starts correcting, if it's always elevated, even with your medication, and it starts coming down when you start seeing this or using this, you have to go back to the doctor and have them adjust the dosages. So that's something that, again, depending on the severity of your condition, we always keep a watch out for. But, in one of those cases, my patient was wearing a glucose monitor on his arm, so he could see it. He was watching it on his phone, and he was tracking it like hour by hour. You could see it. So, wanted to bring this up to you. If you are taking it, you want to take 2 capsules twice daily. That's going to be the effective dosage for that. Berberine studies show it's as effective as metformin in correcting elevated blood glucose with alpha-lipoic acid also supporting normal A1C levels. The berberine also has cardiovascular benefits as well. Circulatory system, anti-inflammation. Alpha-lipoic acid supports your liver health, brain health. So there's a few other benefits that go along with it as well. So your handout shows you that that's the supplement suite. We only discount the supplements the night of the class to just incentivize you to make application with what you're learning about. So these are the only times that you'll ever see the discounts on the supplements. So please take advantage of it before you leave, because there are limited quantities, but if it's something that you need, see them on the way out, and they will, tomorrow and Deborah will help you with that. All right, so I want to take a quick, literally a 60-second break to get the blood back in your brain. I want everybody to stand up, turn, and put your hands on the shoulders of the person to your right. The person to your right. Yeah, and squeeze their shoulders. Get some blood going there. Squeeze their shoulders. This is called a massage. Very good. All right, karate chop. Very nice. Good job. You guys are doing great. All right, turn around. Love your other neighbor. Love your other neighbor.
I needed that.
Are you guys awake, or is this putting you to sleep also? All right, give yourself a round of applause. Nice. Okay, so how many of you guys know what the Core 4 is? The Elevation Health Core 4. Who can tell me what the 4 essentials are? Function, fitness, nutrition, education. So up to this point, we've done all education. We're going in reverse order. So now we're talking about fitness. Is exercise important for your blood sugar?
Yes.
Yes, okay. But insulin sensitivity and clearing blood glucose can sometimes happen independently of one another. So what does that mean? If you go for, let's say you eat a meal with high glycemic index, and your blood sugar goes whee, right, and way up there. So what can you do to help to clear some of that glucose out of your bloodstream? Like within 20 minutes, go outside and go for a brisk walk. Go for a brisk walk, right? Now that doesn't trigger your body to make insulin to get the glucose into your cells like I showed you. It just directly puts the glucose into the muscles. It can sweep it up and clear it out of the system. That's pretty cool, isn't it? So that's one way. That's an independent mechanism of clearing glucose from your system. However, that does not have an impact on insulin sensitivity. What did I show you insulin sensitivity was? It's when insulin goes up and then your glucose is coming into the bloodstream. Insulin goes up and it's made by the beta cells. Your body has to make that. And then what happens? The insulin goes, opens the key, opens the lock, and then allows the glucose to go in. Remember that, right? So we're talking about two different things. So in terms of regaining insulin sensitivity, studies have been done. And what they show is that exercise does not help to necessarily regain insulin sensitivity. What? I thought you needed to exercise to lose weight. Will exercise cause you to burn calories? Yeah. But what did we say causes weight loss? Not burning calories, what? Hormones. Hormones. Is that ringing a bell? Insulin. All right, so we got to correct the insulin sensitivity. All right, so here's the study that we want to talk about. They had a group of patients that all they did was they dieted, they lost weight, right? And this group of patients, they did not exercise at all. All they did was lose weight from dieting. They regained insulin sensitivity by, ready? 70%. How much? 70%. Then they had another group in the same study that exercised but did not lose weight. They did not diet. How much or what percentage of insulin sensitivity was regained for them? 0%. Then they had a third group. And that third group was dieting, they lost weight, and then they exercised also. That particular group had an 84% improvement in their insulin sensitivity. Okay? So, what did that study show us? That the primary component to regaining insulin sensitivity, correcting your metabolism, is what? Weight loss. Yeah, weight loss. Very, very important. And I've seen that. Yes, the supplements are important. Everything else, the food is important. Everything that I'm showing you tonight is important. But when you can lose weight, automatically your body starts to regain insulin sensitivity. Is that making sense? Right. So in our office, we have a program that actually focuses not on just losing weight, because anybody can lose weight. Like if you eat very, very little, like every day, day after day, you don't eat a whole lot, you're going to drop weight. But the question is, what kind of weight are you dropping? Are you dropping fat? No. You're dropping muscle mass, water, and that's not very healthy at all. And in that process, your body kicks into a survival instinct, so what does it do to your metabolism? It slows it down. And then when you're done losing weight, when you're done dieting, you look down, the scale shows you that you're 10, 15 pounds less, and you're like, woohoo, I can start eating again. But your metabolism is slower than it ever was, and now what is it doing? It's packing on the pounds again. And it resets your fatness thermostat. So your weight goes up even beyond where it was before you started dieting. The program, the way that you're supposed to do it is to make sure that you use a body composition analysis. And so when you're getting on the scale, you can actually see that you're not losing muscle and water. You only want to lose fat. You have to target that specifically with the type of foods that you eat. You have to target that specifically with your hydration. You have to target that specifically with supplements. And you have to keep a journal and make sure that you're doing the right things. So we have a very specific program and protocol that takes our patients through that. So where you see the readout. Every time you get weighed in, it shows you your BMI, your body mass index, your body fat, your visceral fat, your metabolic age. You could be 60 or 70 years old, but your metabolic age could show 90. What does that mean? You have the metabolism of a 90-year-old. It's working really, really slow. And until you get that fixed, you'll be dieting until the cows come home, but you'll never be able to keep the weight off until you correct the metabolism. So all these factors have to be addressed. The weight has to come down, but the body fat has to come down. So if you see that you've lost 15 pounds, when you look at that body fat amount of pounds, what should that be? 13, 14, 15 pounds of fat that you lost out of the 15 pounds, right? Otherwise, what is it? You lost muscle and water. That's no bueno, right? So that's why this body composition analysis is very, very important. And in order to lose fat, you have to be hydrated. So I wanted to point out all these things so that you could see the right way to do it, and there is a right way to do it. And many of us have done it. We've tried it and it's not working, hasn't worked, it's frustrating. But there is a right way, and there's a way to do this where you have a very predictable outcome, and you're happy with the results, and you get to keep the results. So I just wanted to share that with you. I forgot I had a video here. I'm going to play that right now. You ready?
Good morning, my name is Kathy Stevenson. I am so excited that I lost 20 pounds in 31 days. I met my 20-pound goal.
Go?
Yes.
I'm Tom Brady. I've been, today's the 16th of April. I've been on the program my 43rd day now. I lost a total of 25 pounds and I've cut my insulin down to under a third of what I was taking.
Awesome.
So I'm going in the right direction. Program works.
Thank you. So proud of you. Thank you.
Yeah, it's a fantastic program. If you never heard of it, if you didn't know that we did such a thing, I would encourage you to ask about it. If you've never had a measurement with the body composition analysis, basically you stand on the scale, we take your shoes and socks off. It puts a very low level electrical impulse through your body. You can't feel anything, but there's an algorithm that the computer works with to break everything down. It shows you your total body mass index, it shows you your body fat percentage, your muscle mass percentage, your water percentage, your metabolic age, your visceral fat, how much fat is around your liver, around all your abdominal organs. So we're happy to do that for you. If you're a patient here and you're under my care and you've never had that done before, just ask Deborah. We're going to do that complimentary for you if you would like, just tonight because of the event. Anybody else, if you would like to have that testing done, that body composition analysis, normally it's $99. We can do that for $37 if you want to make that appointment. If you decide to do the program, we're doing $300 off, and that expires in the next 10 days. We sent that offer out, I think, a few weeks ago, and we've had some response to it. But just letting you guys know, there's a couple more days that we have this, that we're offering that $300 off the entire program. If you feel like that may be something that you need, please ask them before you leave. They'll set up an appointment for you. We'll get you on the scale, and we'll see if you're a candidate for the program. We'll let you know. But what does it come with? There's a full food plan. It's all fat burning. It teaches your body, you literally program your body to be a full-time fat burning machine. There's a manual that you use. There's a journal that you keep every day. When you come in and you meet with Deborah, she goes through that journal with you, and she makes sure that you're on track. We basically hold your hand and make sure that we help you get to the mountaintop on this. It includes the follow-up weigh-ins. If I had a nickel for every diabetic patient that started this program that was either almost off or completely off all their medications inside the 30 days, sometimes inside of 2 weeks. That's how effective this is. And we give you a guarantee. So you'll lose at least 15 pounds within the 30 days, or we put you through a second program at our expense. So again, if you're interested in that, please ask them up front and we can help you. So what's the last but most important factor for metabolic health? What is the most important factor for metabolic health? What controls your blood sugar over and above everything else? Cal, you know the answer to this. I don't have to ask. It's your what? It's your nervous system, yeah. So the nervous system has preeminence and control over all of your organs, over all of your body chemistry, and it can affect your blood sugar even without food being present in your system. So when you look at the chart here, you'll see that the spine is basically there to protect the spinal cord and all the nerves. If you look way up at the top, there's a quote that comes out of Gray's Anatomy, which is the standard medical textbook in all medical schools. And what does it say? It says the nervous system controls and coordinates all organs and structures of the human body. Misalignments of the spinal vertebrae may cause irritation to the nerves, which could affect structures, organs, and functions listed under the areas. Now, these are the areas. So there's two areas primarily which could, and I have seen, affect a person's blood sugar and metabolism. The first is right up here, right under the brainstem. The first cervical vertebrae is called the atlas. What's it called? Atlas. Why do they call it atlas? Because it's a little 2-ounce bone that holds up your head, the 10-pound bowling ball. We talked about that yesterday. Yeah. So it's only held together by ligaments. Every other bone in your body is separated by discs, which give it a little more stability. Up here, only by ligaments. So it's subject to twisting and turning a little bit more, but it's the worst area for that because it has the most amount of nerve fibers. It's right on the brainstem. And the brainstem controls your blood pressure, your breathing, your immune system, your sleep, your balance, so it can cause all types of stuff, your blood pressure. But it also is right there where the vagus nerve comes out and goes down and controls everything in your body. Everybody say vagus.
Vegas.
Vagus. That word in Latin means wanderer. Why do they call it wanderer? Because it leaves your skull and it goes down to innervate and control your respiration, your cardiovascular system, your digestion, your blood sugar, and everything else. And in this picture up here, right up here, it says sympathetic nervous system. The vagus nerve basically is involved with the sympathetic and the parasympathetic part of the nervous system, which helps to either what? Ramp up, right, the tone of that vagus nerve or slow it down. What happens when you're all ramped up from stress? What does it do to your blood sugar? Goes up, yeah. Cortisol is a hormone. Hormone. Remember we talked about weight? Hormone. Everything is hormones, guys. So when cortisol goes up, guess what other hormone it takes with it? Insulin. Yeah. So that's why when you see people under stress a lot, constantly, and again, it never ends, what do you see? Eventually they gain lots of what? Weight. And eventually you see them becoming diabetic. That's because they're always in that fight or flight, and it's dominated that central nervous system, that autonomic nervous system that has been ramped up. It's changed the tone of it. Now, that top bone in the neck sits right there. You see the vagus nerve. I gave you the little lines there so you can see where the vagus nerve comes right in front. Now, when I make an adjustment in that area, what do you think it does to the tone of that vagus nerve? It relaxes it. Yeah. So all of a sudden, you can see a person go from ramped up to, you go home and you have the best night's sleep you've ever had that night. After your first adjustment, it's one of the most common things that I hear. Because we're making an effect to that vagus nerve. Does that make sense? So, what it says here is that can easily be damaged by excessive motions of the vertebrae caused by upper cervical instability. What could cause the upper neck to be unstable? How about being yanked out of the birth canal? By C-section, vacuum extractor, forceps? Wow. You mean the moment an infant takes its first breath, it has a misalignment of that causing an interference neurologically? Yeah. Wow. In that area, what did I say also? It controls your immune system. So it's not uncommon for kids to start having allergies and ear infections and asthma and autoimmune problems right from the get-go because of damage to the atlas affecting the vagus nerve. And that's why infants and babies respond so well to chiropractic care when it's applied appropriately at the right place and the right time. Bet you didn't know that, did you? My kids have been adjusted since literally within minutes of their birth. And I'll get around to telling you their health history, and it won't surprise you because they've been adjusted all their lives. And it's preventative of this. But then, everybody, as children, you fall thousands of times learning to walk. Sports causes misalignment of the spine. Car accidents, fender benders. There's only a fender bender, only a bump, 10 miles an hour. Guess what? Force equals mass times acceleration. What does that mean? An 8 mile an hour impact isn't just 8 miles an hour. It's 8 miles an hour multiplied by a 4,000 pound car or truck. That's damaging the ligaments that hold that atlas in place. Causative factor. Right? How about sleeping positions? Yeah. Text neck. And sitting at a computer, yeah. I just took my son's X-ray. My 21-year-old came home from college, and I just got new X-rays on him because he's getting adjusted up there in Pensacola. I found him a chiropractor. but I took the x-rays here so I could see how he's progressing. Every one of his x-rays improved, got him a good chiropractor up there, except his neck got worse. Why do you think his neck got worse? What's he doing? He's studying now with his head down. He's not doing home care. So I showed him, I said, it's time to start doing the dental roll. He's like, show me tonight, I'm all in. Okay, good. So it's not terrible, it's not as good as it was last year, but at least we're keeping tabs on it. But these are things that affect all of us. And if you're not getting checked on a regular basis, you have no idea. You have no idea what happens as time goes on. Look at the progression of this, of what it does when you lose the curve in your neck and your head goes forward, how it puts pressure on your spinal cord and the vagus nerve. I got this off the internet, guys. This came from a medical website. Medical doctors now are doing studies in every field of medicine showing how the vagus nerve is connected to all forms of disease, from Alzheimer's to autoimmune diseases. And they put vagal nerve stimulators in people's necks. Surgically, they implant that to change the tone of the vagus nerve, something that I do with a chiropractic adjustment. Did you know that? Some of you know that, but most of you don't know that. So you have to understand how this whole thing works. My youngest son was talking to me yesterday. I said, I'm frustrated. I'm like, why is that? So I was talking to my friends, and I'm trying to tell them, about, we were talking about chiropractic, and they're like, oh, it's only good to get you out of pain, You just go there and get your back cracked. And my son's like, no, that's not what it is. It's to keep you healthy. And they're like, nah. And he's like, what's wrong with these kids? They're stupid. I'm like, no, you're the salmon swimming upstream. They don't know what they don't know yet. They have not been educated, and their parents probably have not been educated either. So this is, I'm not talking to you even about chiropractic now. What I'm talking to you about is neurology. Right. Neurology. The only thing that chiropractic is a tool to remove the interference to a nervous system that is supposed to be functioning without interference. Right or right? Yeah, that's all that it is. And that's how I approach it. And yeah, I mean, does it help you feel better? Does your back feel better? Does it stop it from degenerating faster than it should? Yeah. But more important than that, if staying out of doctor's offices, taking less medication, avoiding unnecessary surgeries, lowering your risk to all of that is important to you. There's nothing more important. And this is what studies are showing. So I want to finish with this story. Okay, so in that chart, I told you that blood sugar from your nervous system can be affected by how many different areas in the spine? 2? How many fingers am I holding up? 2. Your blood sugar is dropping. So this is one area right here. The other area is sometimes directly in the mid-back. So this lady walked in like this. She's like, Dr. Yachter, my back is killing me. Can you help me? I said, let's check it out. So we got her into the exam room. I took an x-ray, and she was probably in her late 60s, but she couldn't stand up. And I got the x-ray, and on the x-ray, it kind of looked like that. Bone was out of alignment. I could see it pinching the nerve. I'm like, oh, that's got to be what's causing the problem. So I laid her on the table, and I very gently tried to start getting some movement in there. Let's see if we can open up the joints, get some pressure off the nerves, and I felt it move. And then I told her to get up off the table, and she got up off the table, and she stood straight up, just like that, standing straight up. Like, wow, good, excellent. And then I looked down, and she's wearing an insulin pump, and I didn't see that because she was bent over so badly before. So I said, oh, you're diabetic? She said, yeah. I said, okay, well, just come back tomorrow. I want to check up on you, make sure you're doing okay. She's like, all right, no problem. She leaves. About an hour later, somebody's screaming, opened the front door, screaming at the top of her lungs, call an ambulance, somebody's passed out in their car. I saw her leave your office. It's your patient. So I ran out there, and there she is. She slumped over the steering wheel. And I ran back in, and I called the ambulance, and as I'm hanging up the phone, I'm thinking, oh, she's diabetic. Maybe it has something to do with her blood sugar. So I got some orange juice, and I came out, and I started dabbing it on her lips, and she started coming to. And as soon as she started regaining consciousness, the ambulance came, and they got her out of the car, started driving away, and I'm going back into my office and I'm thinking, what just happened? I mean, she stood up straight. I thought I was the hero. I thought I just changed her life, you know, and now she's on her way to the hospital. That's not good. That's not good for business. I hope I don't hear from her attorney. I mean, all these things are going around my head, and I didn't sleep a whole lot that night. So I came into the office early the next day, trying to figure out what happened. And to make a long story short, I did figure out what happened, and here's how. I was adjusting patients who was very busy, and I see the front door open, and there's Georgia. Very next day, she opens the door, and she's smiling. And I'm like, thank goodness. She's smiling ear to ear. Her face is like sunshine. She looks 10 years younger, and she comes over to me, gives me the biggest hug. She's Dr. Yachter. I don't know what you did yesterday, but I haven't slept this good and felt this good in 40 years. Can I have another adjustment? And I said, yes. But before I do, I need to show you something, because yesterday, after that happened, you got taken away by the ambulance. I thought I did something wrong, but I think I did something right. Let me show you. I said, remember on the x-ray, the area where I showed you the nervous pinch causing your back to hurt? She said, yeah. And so I took her over to the chart. I said, on the chart there, that's the same area where the nerves go out to your pancreas. And when I opened up the nerve channel, it started releasing the nerve supply and the communication to your pancreas. So your pancreas started making insulin, but your pump was still on, so you got too much. And I think that's why you passed out. She's like, that makes sense. Are you going to adjust me now or what? So did not care about the explanation, the science. She just knew it worked. So she kept on her adjusting schedule, never missed an appointment. And a month later, I did a progress evaluation, and she told me she went from 8 units down to 5 units, and her back hadn't hurt since that first adjustment. So that was not a part of the conversation. A month later, at her next progress evaluation, she was from 8 units down to 3 units. At the 5-month point, she was down to 0.8 units. It was such a dramatic change that her endocrinologist at the University of Miami wanted to know what my clinical protocol was for reversing diabetes. Now, this was not type 2 diabetes, guys. This was type 1. It's type 1. Whole different scenario. So her body was not able to make insulin, but somehow the brain reconnected to the organ and got something jump-started there. And that was a real thing. Otherwise, that wouldn't have happened over the next 5 months. He had her eligible for a special study for a 67-year-old brittle type 1 diabetic. Never saw a recovery like that. So I'm sharing that with you because you never know what the cause of a sickness or a disease is. We never even think to look for it. Is the cause of diabetes the lack of a medication? Is the cause of high blood pressure the lack of a medication? Is the cause of any disease the lack of a medication? No. It's not adding more to the body. It's finding and removing the interference and getting it out of the way so the power that made your body can heal your body. The body doesn't need any help. It just needs no interference. The adjustments remove the interference to the amazing intelligence that God created you with. And that's always there. So healing doesn't come from the outside in. It comes from where? From the inside out. No different than when you cut your skin and it heals, or you break a bone and it heals. It always heals from the inside out. So what is health? It's a state of complete physical, what else? Mental and social well-being. What does that last part say? Not merely the absence of symptoms of disease. You know what? How do I say this nicely? When people say to me, "Man, I love what you do, Doc. I'll get checked when I need it." What does that mean? That means that you feel good. That means so the absence of pain, you believe it means that you're healthy. Clearly, the World Health Organization disagrees with that, and anybody who's been diagnosed with cancer who felt great would disagree with that. Anybody that's had a heart attack out of left field, right, or a stroke suddenly, who did not have any symptoms 10 minutes before that happened, would disagree with that. right? So when is the best time to have your nervous system and your health evaluated? After you have a health problem or before? Before. Now clearly I take care of people all the time that come in with problems. Of course, I'm here to help everybody. But the most practical and wisest time to have your nervous system checked with the right diagnostic criteria is long before. Just like you go to a dentist before you have cavities, right? And how do we do that? We do that with thermography, which is NASA space technology. We scan the spine because skin temperature is measured by your autonomic nervous system. So this can give us a snapshot of any problems that you may have. And if we do, like the one on the left obviously is abnormal, right? The one on the right is normal. And if we do suspect a problem, then we get x-rays. And then we look at those two together. We do a comparative analysis. And if there's something that needs to be addressed, wouldn't you rather know about it before it's too late? Yes or yes? Yes. Yeah. So that's why, I'm mostly speaking to the guests here right now. There are guests here, and I like to make sure that you have everything that you need to make an educated decision. It's always up to you, to do this or to not do this. But I want you to understand that I know your health is important to you, and I want you to make a good decision. And if you think that this is a good decision, then what I am going to offer you tonight is the ability to have the consultation, the examination, and the x-rays. Normally it's over $500 worth of service. And we have this Friends and Family Health Pass. So when you use this, it's only $97. And that includes the x-rays, includes the report of findings, and we usually don't include the x-rays with this. But on behalf of the guest or friend who invited you tonight, or loved one, please take advantage of this. You will really appreciate and value the information that you get from it. And from there, whatever you discover, I'll give you answers, detailed answers about your health in any way that I can help you moving forward from there. This has a 2-week expiration date on it. So if you would like one of these, please see them before you leave tonight. Deborah, tomorrow, will get this for you. They'll help you make the appointment and show you how to use this. If you have friends or family that are not here tonight, and you really wish they were, and you're thinking about how they could benefit from this, you're welcome to get one of these for them as well. But hopefully what I've shared with you tonight has been helpful. So if you're a guest, please don't leave tonight without seeing them at the front desk for that appointment. If you want to get any of the blood sugar control supplements, the resources that we talked about, 15% off tonight only. The body composition analysis also. If you need an appointment for that, please let them know. Make application. Information without application is hallucination. All right. Love and appreciate you guys. Thank you so much for being here. Take care.